Welcome to Pullman Regional Hospital, and thank you for coming to your preoperative visit. The pre-op visit lasts about an hour and is designed to prepare and inform you about your surgical procedure. The majority of your pre-op visit happens in the same-day services department. In a private room, you'll meet with multiple staff members involved in your care, primarily our pharmacists, nurses, and lab personnel. Additionally, depending upon your doctor's orders, a respiratory therapist may come in to perform an EKG, which is a heart tracing. You may be taken to imaging services if an X-ray, ultrasound, CT, or MRI is required. For procedures expected to result in a longer hospital stay, you might also meet with our hospitalist, a hospital-based internist who will be involved with your recovery. During your pre-op visit, we encourage you to ask our knowledgeable staff any questions or raise any concerns you may have. During your meeting with our pharmacist, information will be collected about your medications and allergies. Please notify our pharmacist about any blood-thinning medications you take, such as aspirin, Coumadin, warfarin, or Plavix, as these medications are of special concern when having surgery. These are not to be taken while at the hospital, but are brought in to clarify any medication questions that arise. It is important for your safety that our hospital staff is in charge of medication administered while you're here. You'll be instructed on what medication to take or not take prior to your surgical procedure. You will also meet with a registered nurse who will interview you and review your medical history. This nurse will provide you with additional information and instructions about your surgical procedure, what preparations you may have to make, and the time you need to arrive on the day of your surgery. The lab staff may come in at this time to perform a blood draw if ordered by the doctor. Next, if necessary, a respiratory therapist may come see you to perform your EKG. You may be taken to imaging services for additional testing, and, if needed, you may meet with the hospitalist. If your surgery requires an overnight stay or longer, you are welcome to bring personal toiletries, your own pillow, reading material, music, or other items such as a laptop computer, which may help make your stay more comfortable. We have free Wi-Fi access for you and your friends or family to use. Please understand we make every effort to keep all surgeries on schedule. Factors such as emergency surgeries, cancellations, or surgeries taking longer than expected may mean yours is delayed. Our staff will be sure to keep you informed. There are some general instructions that are important for everyone to follow before surgery. Do not eat or drink anything, including water, or chew gum after midnight the night before surgery. This is so important that if you do eat or drink after midnight, your surgery may have to be canceled. Feel free to brush your teeth and rinse your mouth the morning of surgery, taking special care not to swallow anything. Do not drink alcoholic beverages in the 24 hours before and after your surgery. If you smoke, try to quit or cut back before your surgery. This will allow your body to heal faster and will reduce your risk of complications. Notify your surgeon's medical office if you become ill, have a bad cold, chills, fever, or signs of infection. These symptoms may postpone your surgery. Take a shower or bath the evening before or morning of your surgery, following the instructions for the antimicrobial soap provided. Do not shave any hair in the surgical area. In the operating room, special antibacterial soap will be used to wash the surgical area, and at that time the surgical area will be shaved if required. Leave all valuables such as jewelry and money at home. Remove all body piercings, and wear comfortable, loose-fitting clothing to the hospital. Do not wear makeup or nail polish the day of the surgery. On the day of your surgery, please check in at the information desk at the front of the hospital. You'll then be escorted to the same-day services department, where you will change from your clothes into a hospital gown and slippers. 1 or 2 family members or friends are welcome to stay with you until you go to surgery. A registered nurse will complete a brief physical assessment and confirm the information in your medical record. Please understand that while every effort will be made to keep precisely on schedule for your procedure, surgery times are affected by many things that can cause changes in the schedule. Prior to going to surgery, you'll be asked to remove any dentures, contact lenses, jewelry, and all body piercings. If you're allergic to any substance or medications, a distinctive wristband will be placed along with your identification wristband. We will then start an intravenous or IV line, which provides a way to give fluids and medications prior, during, and after surgery. An important part of your surgery is anesthesia. An anesthesia provider will talk to you before your procedure to explain your anesthesia options. The anesthesia provider will help you decide which option is best for you and will determine if any medications are needed prior to your surgery. You may receive a medication through your IV prior to surgery to help relieve anxiety. Before going to the operating room, an OR nurse will review your chart, double-check your allergies, and ask questions that are vital to your safety. At the appropriate time, an OR nurse will bring you to the operating room where you will be helped onto the table and covered with warm blankets, since this room is a bit cool. The operating room is staffed by a team of professionals dedicated to providing sterile equipment and a safe surgical environment. You may notice that your doctor and surgical staff are wearing special gowns, masks, and gloves. This is necessary to keep the equipment and instruments sterile. The anesthesia provider will be at your head during the entire procedure. They will attach some patches to your chest to monitor your heart. A blood pressure cuff will be placed on your arm and a small clip placed on your finger to monitor the oxygen level in your blood. You may be given some oxygen through a mask or small tube under your nose. Your anesthesia will now be administered and the procedure will be performed. While you're in the operating room, your family and friends can be in the waiting room. When your operation is completed, your doctor will speak to them. After your surgery, you'll be taken to the Post-Anesthesia Care unit, also known as the recovery room, where a registered nurse will monitor your vital signs while your anesthesia wears off. As you're waking up, you'll be encouraged to take deep breaths and to cough to clear secretions that may have settled in your lungs during surgery. During this immediate post-operative period, you may experience blurred vision, chills, a dry mouth, and an increased sensitivity to noise. The area of surgery may hurt or burn. The nurse will ask you about your pain and is ready to give pain medications your doctor has ordered. You will remain in the recovery room for about 1 hour before returning to your bed in the same-day services area or to your hospital room if you're staying overnight. If your surgery only requires a local anesthetic, you may bypass the recovery room and return to the same-day services area where you will remain until you're ready to go home. Your friends or family may be allowed to see you now. After returning to the same-day services area or to your hospital room, nurses will continue to monitor your vital signs, dressings, drainage tubes, fluid, and IV line. If you experience any pain, nausea, or any discomfort, tell your nurse so they may administer your prescribed medications or help you get more comfortable. Pain control is an important part of your care. Deep breathing, coughing, and leg exercises are encouraged to promote full lung function and to improve circulation. You may be instructed to use an incentive spirometer, which helps with deep breaths. Nurses will assist you getting out of bed, walking, or going to the bathroom if needed. Your doctor and nurse will decide when it is safe for you to go home. You should be able to drink and tolerate fluids, get up and walk a short distance without feeling faint, and have good pain control before leaving the hospital. Prior to discharge, the nurse will give you and your family and friends specific instructions on activity, diet, medications, care of dressings or tubes, doctor appointments, and phone numbers to call if you have any questions or problems at home. Because of the lingering effects of your medications, you may be helped to your car in a wheelchair. Please plan to have a driver available to take you home, as you will not be allowed to drive yourself. For your safety and comfort, it is recommended that someone stay with you during the day and night following discharge from the hospital. Any questions you may have about your surgery, treatment, recovery, or discharge instructions are welcome throughout your hospital stay and after you go home. Please let us know if you have any questions or concerns. Thank you for choosing Pullman Regional Hospital.